Thanks everybody for joining in this month's webinar. I think it's a interesting topic. It's not something that we focus on a lot because hopefully we don't have that injured horse, but we all know it's just part of owning horses. At some point, they're going to get injured. And how do we feed that injured horse? What should be, we know with certain injuries, what rehab management strategies we should do, whether we should be cold hosing them or doing light walking or stall rest. But how do you put nutrition into your rehab program? So that's what I want to talk about tonight. And this really has the same emphasis, whether it be a minor tendon injury to a catastrophic, maybe the horse was burned or had a huge laceration. So these nutritional requirements are elevated in horses that are injured. So obviously we just touched a little bit on injuries. Oftentimes the most elevated nutritional requirements are with the most drastic of injury. Say a horse has had a severe laceration or colic surgery, or a horse that has had burns. What happens with that horse is when they're trying to heal from that injury, their metabolism goes into overdrive. So when you use the word hyper, it means a lot. If you saw hypo, it means low. So it's in overdrive, hyper-metabolism. And oftentimes we stop feeding them as much because they're not exercising. So we make this assumption that their nutritional requirements have gone down. And then that forces the horse to go into a catabolic state where they actually start eating their own tissue to survive. We'll touch on the nutrients used by the injured horse, the requirements, and then management and feeding of those animals, and perhaps look at some of the other DAC supplements that might be important as part of your nutritional rehab program. So there's many types of injuries, from, as we mentioned, the most catastrophic bone fractures to lameness or muscle injuries, surgery, sickness, any kind of sickness or disease, or a burn. The body responds the same way. So earlier when I was saying it doesn't matter whether it's a catastrophic event or just a muscle sprain, the body will respond the same way to different levels, but it will respond the same way. The metabolism goes into overdrive trying to bring nutrients back to that area. Now, any of you who have been on our previous webinars, we talked about glucose and insulin. And glucose is absolutely critical for these animals as part of their stress response. We've added chromium to a couple of the DAC supplements because chromium enables the horse to unlock more glucose. Therefore, glucose is going towards healing the injury, but glucose is then also potentially going towards growth or just overall health. So what we do with these horses is we stop training them because they're hurt. We usually take them, if they're race horses or standardbred horses, we'll go back to a farm, back to a layup farm or a pre-training facility. If they're our horses, maybe we bring them home to our barn, we take them away from the trainer, and a lot of times they go on stall rest with limited to no turnout, which that in itself, the change to the horse's daily routine, is a huge stressor. And we know that stress impacts their desire to eat and their nutritional requirements. We all know that when we're in pain, it decreases appetite. It causes the stress response. It increases cortisol in the blood. Again, that is a trigger for the animal to shunt glucose into different directions. And that stress response is what elevates the horse's nutritional requirements. Inflammation is often a part of any kind of metabolic injury. This all increases energy demands. When we talk about energy, what are we talking about? We are talking about glucose. And because they have increased energy demands, they don't want to eat, and we often back off on their food because we think they're not exercising, so they don't need the calories anymore. This results in weight loss, and it's hard to get that weight back on those horses. But these horses that have these catastrophic injuries, as I mentioned, their metabolism goes into hyperdrive because they're trying to get as much glucose, as much nutrients to help heal that injury. And so the body's demand for energy or glucose increases. And if we don't supply that nutritionally in the diet, they'll go into that catabolic state where the animal literally starts breaking down their own tissue to fuel energy production and that healing process. It's not common that body protein is an energy source, but in this catabolic state, that's when protein becomes an energy source. So the myths about I feed my horse too much protein and it makes him crazy, it actually uses energy to turn protein into energy, and so it's really not an efficient energy source. But when there's nothing else to use, the animal will break down their own tissue to create energy. These horses then become mentally and physically weak due to that lack of protein. When the body uses all of that glucose, remember that glucose that's stored in the muscle or stored in the liver as glycogen, they'll use all of that up, and then they'll tap into their fat stores and use all those fat stores up, and then it will start to break down its own muscle and break down that body protein to provide energy. As we mentioned, we're going to see loss of top line, loss of hindquarter muscle, then loss of muscles over the wither, loss of the neck muscles. And that catabolism is a very strong characteristic of the stress response that we see when we have this injury or disease and we're not nutritionally compensating for the elevated requirements these horses have. It begins very soon after the injury and persists until your injury or infection resolves. And once the wound is healed on the outside, let's say it was a laceration or burns, there can still be a lot of healing occurring internally even after we've seen the external injury heal. So usually for about a month after we feel like that injury has resolved, we would continue this nutritional program. So what can we do to minimize, avoid, or reverse catabolism, that breakdown of muscles and that loss of body protein? Because when we lose body protein, we really delay healing because it's not an efficient energy source. We can medicate for pain, and what that's going to do is short term, we're medicating for pain. Now, obviously, we know that there are side effects to some of these medications, which we can fix, but short term, we need to mitigate some of that pain so that we can increase the horse's appetite again, get them eating the food that we're going to provide them. We obviously need to resolve whatever, if there's an infection, systemic infection, that would result in your veterinarian prescribing antibiotics. Again, there are side effects to antibiotics, but we can account for that in our management strategy. And we need to make sure that we're giving them enough quality nutrition to support their elevated requirements. So let's just think about, okay, what is a normal horse and what does a normal horse need versus my horse that's been injured? So a non-injured, non-stressed, non-working maintenance horse, about 90% of their calories come from body fat stores, right? About 5 to 8% comes from protein in their diet. Very, very little. But we take that stressed or injured horse, So we're focusing on injury, but let's just say right now in California there are some severe fires, and there are regularly fires in those areas, and we see always every year we see very unfortunate circumstances like barn fires where maybe a horse is not externally physically injured, but that is an enormous amount of stress that is placed on that animal, an enormous amount of cortisol that also moves around that glucose so that they're utilizing glucose to try and get rid of stress, and so that glucose is then not being utilized for energy, and so then they start to break down their own tissue. So just stress alone without a physical injury can also require elevated nutritional requirements because the act of stress changes that horse's basal metabolic rate. So, but let's look at this stressed or injured horse. 50% of the calorie needs come from stored body fat, unlike the previous example where it was more like 90%. 20% of the calories come from stored carbohydrates, and 30% of the calories come from the breakdown of protein, body protein. It's going to start with muscles, but then it's going to end up in your organs. And now the heart is an organ, but it's one of the largest muscles in your body. And the worst case scenario, if these horses, if they were very stressed and very injured and it had gone on and they weren't treated and weren't nutritionally provided for, would be a heart attack. So we've mentioned over and over again, these animals that are stressed or injured, highly stressed or injured, have elevated energy requirements. So we need to make sure that we're giving additional to fuel that recovery, elevated protein requirements to heal that bone and muscle. But their trace mineral and vitamin requirements also increase because we know that selenium, copper, zinc, calcium, phosphorus, these are all critical in tissue regeneration. So there's not a lot of actual data on the sick horse and how his nutrient requirements increase. But if we look at other livestock animals or humans, for example, and we back calculate and we work out based on their body weight, what percentage their requirements increase, we can calculate that a 1,100-pound horse with an infection or after surgery would have energy requirements of about 18 to 22 megacals per day. The normal unstressed horse has at maintenance at the same size about 15 to 16 megacals a day. So we can see that they're slightly elevated compared to maintenance. Now, certainly not what a horse, say a mare in lactation, would be at, but they're elevated. Increased protein requirements in sick and debilitated or injured horses due to that catabolism. We know that a 25% increase in protein requirement has been suggested for sick animals or highly stressed animals compared to maintenance. I think this is a good way to look at it. If we look at that stable maintenance horse doing no exercise, you can see where their energy in the blue and protein in the red, where their basal requirements sit. Right here, around 15 megacals for energy, and right here, right about 18 for protein. Then as we start to do light work, we increase both of those requirements. As we're doing full intense exercise, you can see that the requirements really drastically increase. But if we look at a sick horse and we plot the estimated requirements of a sick horse, that the protein and energy requirements sit right there around a horse at light exercise. It seems you all were only seeing the original home screen. I wish you had have said something earlier. You should be able to see the correct screen now. So you can see there the horse's requirement for light exercise and sits the same. So when I'm designing a ration for a horse that is injured, I'm going to design that ration based on the requirements for a horse at light exercise. We know that trace minerals like copper, zinc, and selenium, as I mentioned, are involved in tissue regeneration. Amino acids like your lysine, methionine, they are important for protein synthesis. And we know that omega-3 fatty acids are needed to boost immune function. Now, typically these horses, their immune system has taken a huge hit. So we're really just trying to boost their immune system again. So omega-3 fatty acids. Now, somebody asked me recently, did we have an omega-3 fatty acid supplement? The DHA Perform is exactly that. It's omega-3 fatty acids. It's the omega-3 fatty acid that's the most important. It's DHA. That's the only thing in that product. It's difficult when we take a horse, let's say a thoroughbred or a standardbred or even a barrel racing horse that's been in peak condition and they had an injury. They are extremely fit. So in the very early phases, as they start to slowly feel better, we do need to try and calm their nerves, do as much minimal exercise as may be allowed, but using something like the Calm B, it is completely safe. It doesn't interfere with any drugs, and it may just help to moderate some of their excitable behavior and their energy. But we also want to look at the types of things that we're feeding them and not feed really high sugar diets anymore. I mean, this racehorse was probably used to eating a very high carbohydrate race feed while he was on the track. So we want to switch that and look at the types of energy that we're providing the horse. We know that we still need to feed elevated energy diets, but we're going to look at feeding more high fat, high fiber based diets to a horse in rehab versus those high sugar starch type diets. And that's going to help with that excitability and nervousness. Also will help control the sugar and starch part of the diet. Now, you know, we've talked in previous webinars about the new the racing formula having the chromium in it, and the chromium will really help these horses because it's going to help to shunt more glucose into the cell from the food that they've digested, and that is going to help fuel healing. We want to add oil to the diet because we're trying to very quickly put more weight back on this horse because they've typically lost a lot of weight. And as we mentioned, their appetite is usually suppressed because of this injury, because of being stuck in a stall, because of their management changing, because of potentially the drugs they're on causing some GI issues and pain, all decreases appetite. So we need to get calories into the horse as concentrated as we possibly can. So beet pulp is a really highly digestible fiber source. It's going to feed that hindgut bacteria. Alfalfa, it's got the good calcium in it that's going to help buffer stomach acid, but it's also really highly digestible. If possible, we want these horses to have constant access to hay. If the horse has been through some kind of abdominal surgery, then we want to make sure that we're feeding constant sources of really digestible sources of fiber like your beet pulp and alfalfa, and avoiding feeding large quantities of grain, because again, that's going to increase the sugars and starches. It might increase inflammation, increase excitability, potentially risk further injury. So you want the body condition score of a sick horse to sit right around 5 to 5.5. You don't want to have them too thin. You don't want them at a 4 to a 4.5, because that is going to, those animals just don't have fat stores to draw on, and we know that fat helps to secrete certain hormones that are going to help with healing. Now, we don't want the opposite extreme where the horse is overweight, but having a horse sit in a 5, 5.5 is ideal. So we also need to make sure that we're feeding really good quality sources of protein. So alfalfa ticks a lot of boxes because it is an excellent quality protein source, but it's also fiber. It's going to feed those gut bacteria, but we need to also be supplying a vitamin and mineral supplement. It's critical to help the body heal. In the past, we had always looked at something like the Total Performance or the DAC Orange, but since we have now incorporated the chromium in the racing formula, I would actually be more encouraging people to feed the racing formula to horses that are recovering from injury, because I will guarantee you there is nothing in the racing formula that is going to make your horse crazy or excitable. It's going to, in a performance horse that's healthy, it's going to shunt more glucose into the cell that can be used for energy and exercise. But in a sick horse, they're not utilizing it. When you shunt glucose into the cell, it gets prioritized as to where it gets used. And priority comes in the form of staying alive, and usually that means dissipating stress or healing oneself is a priority utilization for glucose. So if we were using the racing formula with the chromium in it, and these sick horses are getting that chromium, and that chromium is unlocking more glucose and allowing it to go into the cell and be used by the horse, then it's going to prioritize using that for healing that animal. So I've got here a basic diet with 15 pounds of a grass hay, 5 pounds of alfalfa, because I just talked about that being a super fiber, a pound of beet pulp, and a cup of oil. And you can see that while the animal is getting plenty of energy and protein, it's not getting enough phosphorus or copper, zinc, selenium, manganese, iodine, or even vitamin E. This was just plain old vegetable oil. So what are we going to add to the diet? So by adding, I've got Total Performance here, but I would add the racing formula, because vitamins and minerals wise, the racing formula is on par with the Total Performance, but the racing formula has the added chromium, which is significantly improving these horses' ability to heal. So just by adding the 2 ounces of racing formula to the diet, now we have balanced out phosphorus, copper, zinc, selenium, manganese, iodine, vitamin E. Iodine, you're also going to offer these horses plain white iodized salt, and that will account for that drop there in iodine. So what other supplements might we add to the diet that might have some kind of benefit on healing? I mentioned the Calm B earlier, that it wouldn't interfere with any drugs, it doesn't test, and it would be beneficial to mitigate some of that behavior, especially as horses come out of that initial injury slump where they're really like depressed and they start to feel better. That's when we've maybe taken off some of the splinting, or the support isn't as as elevated. So the CALM-B would be really beneficial to those horses. The E-natural, the natural vitamin E, we know that research has shown that natural vitamin E can significantly increase muscle fiber regeneration, and especially after injury. We talk about vitamin E and its role in developing top line and muscle development in horses. Well, it's just the same after when they've had an injury, that we want to regenerate that muscle fiber. E-natural. The DHA Perform is an omega-3 fatty acid. DHA is, there are 3 omega-3 fatty acids. Remember, DHA, EPA, and ALA, and DHA and EPA are the most effective. And this product is, as the name suggests, it's DHA. That's all it is. It can help with inflammation, but research has also shown that DHA on its own helps with wound healing. The DDA, the digestive feed additive, we mentioned if the horse has been on antibiotics or it's on non-steroidal anti-inflammatory drugs, that we're going to kill off digestive microbes in the hindgut. And so we need to be able to repopulate those, and using the digestive feed additive will help with repopulating. When we repopulate those gut microbes, we get the horse feeling better. That's also going to stimulate appetite. And then finally, the cool gut, because we know there are other side effects to stress, and gut health is a huge one. Gastric ulcers significantly increase when you put horses in stalls on stall rest and you change their management, and their appetites decrease, so they're not producing as much saliva and they're not buffering that stomach acid. And we're using non-steroidal anti-inflammatory drugs because we have to decrease some of that pain. All of these things increase the incidence of gastric ulcers. So using the cool gut as well is beneficial in these cases. So daily exercise stimulates muscle and bone healing. So a lot with your veterinarian, developing exercise plans as soon as possible. Don't be afraid. Oftentimes we're afraid to get them out of the stall and do some exercise. But of course, in your veterinarian's plan, know that daily exercise stimulates blood flow, and blood flow is what increases healing because you're getting all those nutrients to the target issue. Once possible, daily turnout into small pens. Again, using something like the CALM-B to try and mitigate some of that excitable behavior, and use the CALM-B before they go out in the pen, because once your horse is crazy whizzing around that stall, there's no amount of CALM-B is going to calm him at that point. Swimming is always a very low impact injury recovery strategy if you have access to a horse swimmer or even just a walking machine. But in summary, there are lots of different injuries that horses can get. It can be just a minor tendon sprain or muscle sprain, or it can be as catastrophic as burns or a bone break. The body will respond in the same way by hyper-metabolism, breaking down the animal's own tissue. Now, obviously, the extent to which they will do that is different based on the injury, but they will all do the same thing. We know that stress increases inflammation, it increases energy demand, and it causes weight loss. This hyper-metabolism, which then leads to catabolism because we're not giving the animals enough energy and protein, is a vicious cycle. And these injured horses have increased energy, protein, and nutrient requirements. And something like the chromium in the racing formula is going to help unlock more energy to be used for healing. We need to try and decrease that excitable behavior. The DAC oil is ideal along with beet pulp, free choice hay, alfalfa. Maintain proper body condition score. We don't want those thinner horses. The racing formula pellet. So that's a brief overview of feeding sick or injured horses I think that what I want you to get out of it is, don't feel like that you're just going to take all the nutrition away and stick him in a stall and have him heal. Their nutritional requirements actually may be more elevated than they were before. If you had a horse that was a trail horse and he's got an injury, you may actually have to feed him some nutrients more than you were feeding before. So any questions?